First News with Keeler in the morning on WIBX and WIBX950.com.
On the line right now is Dr. Kent Hall from MVHS. Doc, good morning.
Good morning. How are things down in New York City?
Well, I think it's pretty much the same as back home. Very, very hot. Although,
yeah, it is warm, and I don't know when the relief is going to come. But, I was talking to somebody earlier today, and I said, in February, we're going to be longing for these days.
You're right. The beauty of the heat, you can always kind of go into some air conditioning and cool off a little bit, have an ice cream, cool off a little bit, whatever it is. But, man, that cold of the wintertime is just, and you're right, it's February. We're okay with December. You tolerate January, but when it's cold into February and March, it just feels like the winter's never going to end. So we should cherish what we have right now. Doc, let's start with where you guys are on your COVID numbers at MVHS.
Yeah, so we're up to 25 patients in the health system. So we've had quite a spike over the last week, unfortunately. It continues to be the same as it has, which is that the majority of people that are in the hospital are unvaccinated. They tend to be younger, and those are the ones that are in the ICUs and needing the higher levels of care. There are some that are vaccinated that are in the hospital, but they even though they're elderly and have the comorbidities, they tend to not be in the ICU as much.
Okay, that is those people who are. Oops, sorry about that.
Whoa.
Those people that hurt, by the way, terribly. That is people who are vaccinated are less likely to be in the hospital, and I think around the country that number is a pretty large number, right? It's significant.
Yeah, no, it is. So the percentage of people in the hospital that are unvaccinated versus vaccinated is actually very high. I don't have a specific number for it across the country, but it's different region by region, and to a certain extent, that's because different regions have different vaccination rates. And so, if you have a vaccination rate of say 70% or something like that, then obviously there's more opportunity for people who are vaccinated to end up being sick simply because there are more people. But it still remains true that the unvaccinated are the majority of people in the hospital, and the vast majority of people that are requiring ICU level care, ventilators, things like that.
All right, I want to get into the we'll talk all about this, but in a second. But I want to get into the mask issue because we've seen it at school board meetings. There's a story this morning about the governor of Connecticut being chased by angry constituents, screaming at him, pointing in his face, almost seeming violent over the fact that their kids are required to wear a mask in school. We'll get to the school thing. But I had Ed in Syracuse early this morning give me a study on, I guess it's not even a study. He's quoting some of it. But experimental assessment of carbon dioxide content in inhaled air with and without face masks in healthy children. So is there a danger of some sort of poisoning for children who are wearing a mask?
So the very short answer to that is no. Surgeons wear masks every day when they're in the operating room, their entire careers without having issues. There are other professions that need to wear masks for different times, whether they're construction workers because they're working with asbestos, or they're or just painting and they're wearing it for the fumes and things like that. There is no danger to wearing a good mask. I mean, obviously, if the mask is impregnated with something that'll make you sick, then yes. But if we're talking about a regular surgical mask, a cloth mask that you've made yourself, there is no danger at all with wearing that for extended periods of time. And
the reality is, you're seeing a lot of the kids that are wearing masks that are acceptable are the cloth masks or the bandana type situation, and even though they probably don't protect as much, they're still allowed by schools, right?
Correct. And the reality is, remember, what the mask is designed to do is not as much protect you as to protect. I mean, yes, there is some protection for the individual who is wearing the mask, but the majority of the protection is actually for other people around you from you yourself. And that is because so I want you to wear a mask when you're around me, and you want me to wear a mask when I'm around you, because that's really helpful and protecting. And yes, there is, what the masks do, and obviously depending upon the type of mask and how large the openings are within the mask, it is to a greater or lesser extent. But what they do is they stop the spread of the droplets and the aerosols into the environment. And when you're in an enclosed environment for an extended period of time, read a school classroom, then that's when these aerosols stay in the air and other people can come in, and if they're not wearing a mask, then they have a higher likelihood of getting them into their respiratory system. And that is why we want people to be wearing masks when they're in those environments, so that there are fewer of those particles that are floating in the air, just looking for a nose or a mouth or an eye to get into.
Every one of these studies, though, Doc, has someone, a physician. In this case, this study had like 4 or 5 physicians attached to it that are a part of this. How do you explain when another doctor or 2 doctors or 5 doctors come out and say, this is dangerous, despite what maybe the majority of doctors say? Yeah,
so first of all, doctors are human beings, and they're going to have their own responses based on not just their training and experience from a physician standpoint, but also from their viewpoint as being a human being. So, what I look at is not what an individual says, but what does the profession as a group say, and you will be hard pressed to find a professional society within medicine across the board, whether it's emergency medicine, anesthesia, internal medicine, surgery, that says that mask wearing is dangerous for kids. You will not find that.
It's almost like when your pediatrician tells you if your kid's going to be outside at night, especially after it's been humid, spraying some bug spray on the kid. Is it possible the bug spray could be dangerous? I remember our physician saying there are some studies. Yes, make sure your kid washes it off before they go to bed. The dangers of some of the viruses carried by mosquitoes are greater than the dangers of the actual bug spray. And the same thing is true here. If there's some sort of danger psychologically or medically with masks, it's so slight as compared to the potential danger of the virus, the kid getting it, or spreading it to an adult or someone that has some sort of a comorbidity.
Yes, that is a very good point. Is that the whatever minimal danger, and I really can't minimize it enough, but whatever minimal danger that there may be related to wearing masks is significantly offset by the protection from a virus, which we all know from the last year and a half is causing significant morbidity, is killing people, is sending kids to the ICU, and then people are staying sick for extended periods of time, upwards of 6 months, 8 months, a year, and so the danger from the virus far outweirs the potential danger from any mask wearing.
And for these, here's Justin in New Hartford. Not sure if you guys heard, the Whitesboro board meeting earlier this week had to be shut down before it started because of unmasked, unruly parents. There are many things in this world to fight about, many things that you can disagree with and argue over. I just feel like you got to pick your battles. And parents, is this the real battle? I think the battle of kids having to learn remotely is a valid battle. My kid isn't learning as much as he or she should because They're doing it remotely. That's a valid battle. That's one worth arguing. I just think the mask thing is ridiculous.
Yeah, I have empathy for people who want to live their lives the way that they want to live them, and certainly, you know, in a world where we don't have these kinds of really community level and national level and world level issues, then that is where we want to be. But you know, we're in a pandemic, and we're still in a pandemic, and the science will tell you that we as a species, the human race, is better off wearing masks, staying socially distant, you know, until we can get this pandemic under control. And it's not under control yet. And if you look at what's going on around our country, it's not under control. So again, I go back to follow the science. And what does the science say? And the science says that, you know, to what you were saying earlier, the benefit of wearing a mask and not getting sick far outweighs any detriment to wearing the mask and staying socially distant.
Last night I was on we were going to the Mets game, and I was on the subway, and I couldn't get my mask on tight enough. I'm telling you, it was, I mean, the people sneezing. I mean, everybody's wearing a mask. Everybody. It's required on any public transportation in New York. But, you know, the sneeze, there's one guy that's just I couldn't get my mask on tight enough. If you want any anecdotal evidence, Dr. Hall, I would assume that the fact that you didn't have a cold last year, you didn't get the flu last year, are pretty valid examples of mask wearing and what it accomplished for us last year.
No, that is exactly right. And it is also one of the things that we are about this year is that, you know, we're going to have the flu this year. We didn't have it last year, which, you know, imagine what it would have been like for us in the healthcare field if we had, you know, just a regular flu season in addition to what we had with COVID. So
yeah.
We are looking at and concerned about what might happen related to the flu, but we are prepared.
Quick question, and I have about 30 seconds. Randall's in New Hartford announcing that pharmacy is giving the flu shot out now. Should you get the flu shot now, or should people wait?
So, you know, this is the beginning of getting the flu shot season. You know, I always opt for getting it a little bit later because its utility is about 6 months, and the flu season tends to last through March and sometimes into April. However, if there are people who have significant respiratory issues and the flu would be really bad for them, then I would say you can certainly get it early.
Okay. Doc, thanks so much. Have a great weekend. We'll talk next week.
Thank you, everybody. Please be safe.
You do the same.